that I'm actually very passionate about, even though it's like really freaking boring. So that's why I'm here. And I'm glad you guys are here. I just actually talked with me and kind of figured we would only have like maybe 2 or 3 people here.
So I owe you $5.
Yeah, you owe me $5. So we hope that we're actually going to be able to jazz you about this topic, even though the topic of regulations is really really boring. I mean, nobody cares about this stuff, but the whole point is that the feds have come down and said, you need to do this. And by the way, can somebody get me a bottle of water, please? I need a bottle of water.
Beer?
Water.
Beer?
We have beer.
Beer works. Water works better than beer works. So, yeah, and that's kind of, now, I really want you guys to understand that this is what we're talking about, is the operational challenges associated with implementing SOX, HIPAA, and GLB regs. We're not talking about all the, hippie, happy stuff that you have to do with, and I'm sorry, I'm standing up. Love my hat. And then we're not talking about the hippie, happy stuff that you have to do with anybody in your regulation environment. What we really wanted to do with this was to go ahead and talk with you about maybe some really cool ways to implement the requirements for SOX, HIPAA, and GLBA in an operational environment. So I'm not talking. How many of you out there are auditors, by the way? Nobody is an auditor.
We have one.
Suck. How many of you folks are 24/7 working in an operational environment? Coolio, got 2. Well, then you guys don't even need to be here. Go ahead, girl.
Oh, my part?
No, not yet. Yeah. Okay.
You mean like sleep in your server room?
Yeah, buddy. I've done that. Trust me, I've done that. Why regulation? We are regulated because, and this is like a total teaser for me. Oh, I'm sorry. No, I'm so not good at this. Thank you. Ooh, he's teasing me. He's teasing me. Thank you. Can you guys hear me? Apparently not. Hi, everybody. I'm Dr. Nick. You nailed it. See, the reason that we're regulated for GLBA, SOX, or anything else is because we screwed the frickin' pooch. We did not decide to self-regulate ourselves. So we ended up being regulated by the feds. Now, pardon me, pardon my language, I think this is fucked up, but hey, there it is. So we now have actually 326 federal regulations. We're only going to talk about 3. We're going to talk about a couple of case histories. We're going to talk about a little bit about security management life cycles. The only reason I'm saying that we're going to talk a little bit about that is because I have to be honest with y'all. I was really ambitious with this, but figured that I was kind of like limited to an hour. And after talking with my friend Meee here, realized that I probably was a bit too ambitious. Then we're going to go into a couple of compliance methodologies. How do you make it right? I mean, especially if I've only seen 2 people raise their hands at being operational people, but you guys are the ones who have to implement this crap, right? So those are the ones I really want to talk to. I don't want to talk to auditors. I already know about you people. Okay. Compliance methodologies. There is not one methodology out there that fits every siloed organization. And I'm sorry, you can talk to so many people in this industry that would tell you, this methodology is going to work, this methodology, no. It depends on your business silo. And that's kind of one of the things I want to talk about. This is our disclaimer. Yes, we are information security professionals. We are not lawyers. Subsequently, this is not legal advice. Boomow. You go, girl. Okay, actually, this is really cool. I want you guys to look at this. It's kind of busy, I realize that, but legislation does impact all industries. Take a look at this. You've got healthcare, you've got public sector, you've got financial services, you've got energy, you've got life sciences. Take a look at all the stuff you got to deal with. This is insane, but it's the truth because it's regulatory and it's law. What we're going to be looking at is HIPAA, we're going to be looking at SOX, and we're going to be looking at GLBA. But I do want you guys to note, back it up, I do want you guys to note how many regulations we just put up here. There are over 300 regulations that organizations have to deal with. This is freaking insanity. It's insane, but you have to deal with it. Okay. Take a look at how much it cost. That was last year. Take a look at how much it cost to comply with SOX. Let me ask you a question. If you're investing that amount of money in complying with regulations, how much can you really invest in new services and new products? You can't. You're pretty much disabled to be able to deliver new services to companies.
Are you saying like all the compliance things we have now, not only are there too many, but they're just not cost effective and we shouldn't have compliance?
No, I'm not saying that. Well, no, I'm going to turn that back around on you. Do you think we need to have compliance?
I think the California law that requires requires that if your identity
That's
gets
coming up, by
exposed,
the way.
That's damn right. That's a requirement. It should be there.
Why?
Choice point, fucking a lot of people. The
Actually, I called them out in this, but yeah, that's okay.
But you actually just said you turned it on me and asked if we did need it. Are you agreeing with me that we do need it, or
Well, I'm asking you, do you think we need it?
some of it? Yeah.
Okay. Let's go a little further on and we can talk about your question. Actually, I love your question. It's great. What we have, mitigating compliance risk involves there's so many levels involved with that, but I tried to, and Meee, bless her heart, tried to help me kind of like devolve this, okay? So what we're looking at is we're looking at compliance risk. Oh, are they? Oh, they are closed. Oh. Okay, so we're looking at compliance risk. And when we're looking at compliance risk, we're looking at several different risk areas. Oh, God, I hope everybody can hear me. We're looking at non-IT risks, but we're also looking at IT risks. See, everybody here is like totally into like IT and yeah, all that stuff. Non-IT risks is the area that I've been focusing on lately, which has to do with actual policy development, all that happy crap that people go, oh, that doesn't mean anything to me because I'm an IT person. But the whole point of building a business is built on their policy and their regulation. What do we do? When do we do it? How do we do it? We'll get into that a little bit later. You have safety, environment, physical infrastructure, and your business processes and policies. Nobody cares about that. Hey, that's just the guy who's sitting at the front desk, right? Then you go to your regulatory and reputation risk, which has become actually a really, really big thing with a lot of companies lately. Hey, if you, somebody mentioned choice point? Choice? Yes. Let me ask you a question. How much do you think that their failure to keep that information in-house and not get it outside, how much do you think that screwed the pooch for them?
Probably quite a lot.
Bingo! We are talking about reputation. By the way, I think they were probably one, oh damn, sorry guys. I think that they were probably the ones most in the media recently, but I can name out a couple of other organizations that have totally screwed themselves in regards to losing data. Reputation risk. That is the biggest thing right now. Huge. It's enormous. And folks don't get it. They don't grok it. IT risks. Hey, dudes, every single one of you knows www.iss./.com. I love these guys. They bring out all kinds of information regarding not only personal information risks, but they bring out all kinds of information about other stuff. Me, I'm a dweeb, so I'm totally into IP stuff right now. I love this. computer crime, cyber terrorism, internal breaches. How many of you are like internal geeks to your companies? I'm seeing no hands. Hello, I want participation. Thank you.
You're welcome.
Thank you. Okay, so you know about the internal breaches associated with employees who are just not like ready to play nicely, and you also know about human error. You know, it's like, hey, dude, I did something. It didn't quite go appropriately. By the way, this one, I know how to fix this one. This is wrong. Rogue employee, yeah, I call it rogue employees. The only reason I called it that is because how do you classify a group of individuals who are like just not behaving appropriately?
Like willfully violating the policy.
Bingo, you got it.
I've got one. Jail them.
You jail them.
I'll give you a specific example. I contract with the Temple City Unified School District.
Oh, you're from Texas.
No, around here.
Oh, you're from here. Okay.
And we had this guy who, well, I'm not going to say
Yeah, that's okay.
who had threatened to a lot of our teachers and principals, but not to us IT folk, that he had control of the system and would do something to us if we had fired him. It turns out what he had done mainly was just change DNS records to reflect himself as the ownership of the registrar, which interestingly enough is covered under California Penal Code 502C8,
Yes.
and which actually is a felony.
So, what did you guys do about that?
Well, actually, we figured out a bunch of other charges to hit him with, but finally got him for 2 felony counts under California Penal Code 502, and, well, he's now sitting in jail for, I think, up to 8 years.
Interesting. That's awesome. Actually, I think that's awesome, but see, I'm conflicted about all this, and we'll get to that. Your security risks under IT. Actually, there's a lot more here. There's a lot more here. Yeah, under your security risks, there's a lot more here. Under your availability and recovery risks, there's a lot more there. But we've, actually, I think we've listed them out pretty appropriately. Litigation and use of email as evidence, we're going to go into a little bit later. Thank you very much for that. I want to talk with you. Yeah, I want to have a chat with you. Can we go on? Thank you. All right, here we go. These risks are real. These are actual individual developments that were not pretty. First of all, you guys all know about this, so I'm not going to go into it. Yeah, it's been like gone over and over and over again. This one is really interesting. Discovery costs. I have a lot of friends who work in the legal space. This is going to be much more impending in our space as we move along. Quit laughing at me, you son of a bitch. Take a look. No, you're laughing at me, not laughing with me. Take a look at how much money it cost them. $605,000. And that was just one organization. Oh, I love this one. I love that one. $10 million $10 million. Now, that may not seem like much to a bank, but again, let's go back to the whole concept of them losing their reputation because they screwed the pooch, effectively. That's what they did, okay? They screwed the pooch. 10 million. Move it on, girlfriend. Yeah.
That's it?
No.
Your part?
No. Beep.
Better.
There we go. 2005. 42 million consumers. Now, the reason I point this out is not because you guys are all like Uber geeks and all that stuff. You guys are consumers. You guys have credit cards, right? What? You guys have bank accounts? Dude, you're a consumer. 42 million consumers. You Uber hackers, you. Yeah, 42 million consumers got affected by people just like fucking around with their data. Pardon. I didn't say that, girl.
Yeah, you did.
Oh, crap. Sorry. But 42 million consumers. That's a lot of people. That's not right. Or is that right? Now, this is, oh, okay, this is where the hat comes off. Yeah, I should put the bunny ears on. Okay. Legislation for protecting data is only going to get more onerous. And most definitely, and this is the one that really, really hurts my heart, that one, the very one at the top. What do you think that means? I want feedback.
I heard that's going to undermine the California law.
Actually, I've heard that it's not going to undermine the California law. It's going to make it stronger. I want to know your sources, dude. But do you understand where I'm getting at with this? Do you see that how our personal privacy, our personal dignity is being defined by the law?
Whoa, how is a law that's going to protect when your personal information gets jacked? How is that undermining our privacy?
Well, I'll tell you what. Take a look at this. Senate proposes a national database of individually identifiable healthcare information. Excuse me, sir, how does that not hold on, how does that not undermine your personal privacy?
That wasn't what I said. I'm not talking about the second or third bullet point. I'm talking about the first one, the Personal Data Privacy Security Act. Does that have this thing about healthcare in it?
Yes.
But it's not under the bullet point. It's like
Well, I understand that. What I'm asking you is this. You don't have any issue with the government collecting information about you?
I don't have a problem with the first one, talking about basically extending the California law for all states. I see that as a good thing. Now,
Why do you see... Oh,
collecting health insurance.
now that's interesting. Why do you see that as a good thing?
Well, these agencies like ChoicePoint and other, for lack of a better term, identity clearinghouses already have this information. So you can't put the genie back in the bottle. All this is saying is that if those companies get hacked and lose a significant amount of that information, the end users have to be notified. Your information is already out there. This is at least saying if somebody takes it, there's at least a recourse.
There is no recourse. You don't get that.
That's what the law does, though. It says that the person who gets their information stolen has to be notified.
No, you don't get it. See, this law right here, this gives the, quote, government, hello, anybody out there from DOD, this gives the government the right to collect the information on you. And honey, I got news for you. You got no recourse.
Don't they have that information already?
Probably.
So what's the difference?
They're telling you they have the information. Yeah. So this is kind of like to try and make you paranoid.
But I'm going to hold you on this because the California law...
No, that's fine.
The
Please
California
do.
law doesn't in any way say that the state of California, collects the personal information and holds it. The California law 1798 is all about if a third party like ChoicePoint or say your bank gets hacked and loses that information.
Bang it. Bang it. We'll get back to you. I want you to note this. How many of you work for publicly traded companies? How many of you are willing to say that you work for publicly traded companies? Doesn't matter, dude. If you're getting health care, that works. Check this out. Do you see this? 77% in 2004. We're already in 2006. 77% increase in audit and regulatory costs for publicly traded companies. Does somebody not find this insane? I do. Sorry.
If they're like new laws, though, I mean, before the law was passed, obviously the percentage would be 0, and so there would be an increase. If they're having to, suddenly put in infrastructure.
Well, okay. I'm going to go back with you and say, guess what? Publicly traded companies have been audited for years until the incept of SOX, GLBA, and HIPAA. They didn't have to deal with this crap. That is since the incept of the laws. 77%. And if you want to debate that with me, dude, I'll meet you in the bar and we'll have a drink. I wanted to go, shut up, you. I wanted to go into, here's the deal. Time and cost, inconsistency and decentralization, measurement and reporting, and complexity. Those are the issues. I'm really talking here with people on the absolute back end that need to implement this stuff. How do we do this? This is my money. How do we do this? Oh, by the way, no, this is important. See this? Intellectual property. In email. And by the way, I know a lot of legal beagles, and they have validated that for me. Go girl. HIPAA. Oh, by the way, see, records management. Here's a big thing that a lot of folks don't think about. Take a look at what we have on the screen. If you're in healthcare and you're dealing with records management, you've got some real challenges. 21 years to manage to manage records that deal with kids, okay? Pediatrics, okay? If you're in HIPAA and adult healthcare records, doesn't matter how the hell old I am, you just gotta maintain them until 2 years after I die. Wow, okay, that's fun. Take a look at Sarbanes-Oxley. All records related to audit or review. What the hell does that mean? And you want to know something? They can't explain it to you either. But you've got to maintain those records for 7 years after the conclusion of the audit. It's fucked up. Oh, by the way, I'm not sure if you guys all know what SEC 17A4 is. It's kind of associated with the financial Sarbanes-Oxley, GLBA, happy crap. Check it out. 6 years, 3 years. This one I love. Life of the enterprise. I actually went back to the feds and said, dudes, what do you mean by life of the enterprise? They went like from inception until the enterprise no longer exists. Yes, it is a morass. It is a morass. There is good news.
You saved a bunch of money on your car insurance?
Yes, I am. No. No. Here's the good news, dude. Here's the good news. Seriously. You know the 80-20 rule? You guys are all frickin' hackers, right? Are you a hacker? Oh, blow me. Are you a hacker? Well, guess what? There is an 80-20 rule. When I went through all of these regulations and requirements, I realized something. There was like an 80-20 rule. The 80-20 rule turned out, oh, by the way, it's not just GLBA, SOX, and HIPAA, but it works for all the other regs out there. There's an 80-20 rule. Information retention, control your access, and information and progress integrity. So how do we do that? How do you do that for GLBA, HIPAA, and SOX? I'm going to show you. Go, girl. I know this is busy, and I'm sorry it's busy, but just take a look at it, and I want to leave it up there for a while. See, the thing that a lot of folks don't grok is that you now, under the new regulatory requirements, need to ensure that you're keeping your that was so rude. That you're keeping your information stored. So you need data management and storage management. Guess what? You know, if you're publicly traded, you gotta save it. Get over it. Don't have to like it. Don't want to like it, but that's the rule. So, information retention. This is the one that just cracks me up about so many companies. They don't know how to do access management and control for their individual users. If somebody can give me an actual awesome idea on how to do this, I would love it. I have worked with several companies. As a matter of fact, one of the companies I worked with, it took me a year, but we ended up putting together an identity management system for the company under SAP that actually worked out quite well. But this is very, very important. And actually, I probably should have renamed this. What do you think? I'll figure it out. Process integrity. Take a look at what we've got under this. See, most companies don't want to invest in, they don't want to invest in this. They don't want to invest into taking a look at anomalies that come into their environment and subsequently resolve them. Security is not important. Bullshit. It's crap. You need to ensure integrity in your environment. Thank you. All right, so this is a model for IT compliance. Does anybody know what this means? Does anybody care?
Risk management. What's the cost of fixing it versus the cost of dealing with it when something happens?
Well, actually, that's a good point, but I think it goes deeper to actually analyzing who are we, what do we do, why do we do it, when do we do it. Most companies don't have a frickin' clue because they have never done the analysis up front to determine what is their business model. Okay, so, sorry about that, my rant. So, what you do is you assess your, see, I called this a compliance posture, and I did that just for sake. Oh, question?
Isn't a business risk strategy different than a security risk strategy?
Well, actually, no, it's not.
They usually are separate.
Well, but it really isn't, because really when it comes straight down to it, when you define your business risk strategy, you begin to base your security business risk strategy. And I think, actually, thank you very much, because that's really what I'm coming down to with this. What are you at risk with your business? Seriously. Everything has got really tied up with security. Security is now not just, somebody's going to hack me, but somebody might socially engineer me. That's security. Somebody might, like, I don't know, hack my website. That's security. So it's so wrapped up that you have to define what your business, what you as a business are going to absorb as a risk.
I understand that, but usually in businesses, their business division and their business strategy workers.
I'm sorry, my hearing is like really
Those
poor.
developing business plans are not going to take into account IT security.
Then I would say that those businesses are ill-advised and stupid.
That's probably 99.9.
Yep. However, they are getting wiser. They are getting wiser.
Wait, so you're saying you should incorporate your information technology security
Hell yes. You think that's stupid? Why?
Because a business plan is, how you define what your company's revenue streams will be, things like that. How you implement that isn't what you put into your business plan.
Who am I? How am I going to do it? How am I going to deliver it? Security has got to be incorporated in every part of the business. And if you don't agree with that, that's fine. My experience has been that companies that don't do that end up having to go back, re-engineer this crap, and guess what? They end up spending more money in the long run.
Especially if it's like a government regulation one. If you're going to do like a HIPAA software and you don't make it compliant, in that case, I can see that.
Girlfriend's going to talk about HIPAA. I'm going to talk a little bit more about GLBI and SOX. But I've got news for you. Even for little mom and pop businesses out there, dude, you got to think it through. And they don't. And subsequently, they have to go back and re-engineer this crap and try to retrofit crap into it. It's bogus. It's bogus. Okay, so we are now going to have a discussion of HIPAA by Miss Meee. And then I'm going to talk with you all about a little bit about some SOX and GLBA implementation I've done. And then this whole thing is about a dialogue. That's what this whole conversation is about. Go, girl.
1 second.
Oh, you got it? Oh, there you go. There you go.
Give me a second, folks. Good afternoon, everyone. I'm Meee. Welcome to LayerOne. This is the HIPAA portion of the program. Be prepared to sleep if you want to. This is the background of HIPAA timeline. August 21, 1996, President Clinton actually signed the Healthcare Portability Accountability Act into law. On December 27, 2001, President Bush signs the Administrative Simplification Compliance Act. It's supposed to make everything simpler. Yeah, right. Basically, by April 14, 2003, HIPAA privacy rules was supposed to be adopted by all covered entities. In April 16, 2003, entities must implement their compliance plan in order to receive an extension. On October 16, 2003, all entities must comply with the transaction code set into law. Then on April 20th, all entities, basically all entities, have to implement the security rule standard. HIPAA was actually made to was invented to make things simpler. Title I of it basically protects health information coverage for workers and their families when they change or lose jobs. So basically, you lose your job under COBRA, go to find, you pay for that, or you swap to another job, your information should actually transition over nicely. Under Title II, the administration simplification provisions require the establishment of national standards for electronic healthcare transaction and national identifiers for providers, health insurance plans, and employers. Basically, they're saying, make sure everything's secure, but try to figure it out on your own, please. What it brought us. Initially, the provision was 337 words. Current legislation on the books of the Federal Registry, over 101,000 words. What people are saying most is confusion, the cost, and the paranoia. Basically, it's subject to individual interpretations at time. I mean, to the point where even coworkers are afraid to actually talk about each other's health, like, how are you doing? Are you feeling sick today? Well, here's a case sample. HIPAA is law. Seattle actually had the first case where the first person was prosecuted under the federal guidelines. Richard Gibson was a medical technologist over at the Seattle Care Alliance. He was able to access medical information such as Social Security number, patient name, patient maiden name, middle name, address, basically took over his identity while the patient was receiving chemotherapy. They actually have him also on camera buying $25,000 worth of hardware at Lowe's. It was the first time there was a conviction under the law, which took effect in 2003. The city attorney, I believe, was the one in charge of the case, City of Seattle. Under federal interpretation of the law, the Justice Department ruled that most healthcare employees can't be prosecuted for stealing personal data under HIPAA law. The ruling could stop federal prosecution from pursuing more than 13,000 complaints that have been filed alleging violations of those rules. Basically, the person who went to jail, well, if he didn't plea, he could have actually challenged the ruling and actually go back to court and have, but subsequently probably would have been prosecuted under something else, such as Washington State identity theft rules.
Or California.
The security rule of HIPAA, basically to protect against any reasonable threats or hazards to security of integrity of such information. What did that mean? Basically, they don't expect you to build a moat around your whole data center, medical data center, and hope no one gets in it. The other one is to protect against any reasonably anticipated users' disclosures not permitted. Basically, they ruled you're allowed to actually put your chart right beside the patient's care. It's reasonable as long as you have eye contact at it. I mean, most hospitals I go to actually have that. That's a different story. Ensure the confidentiality, integrity, and availability of all electronic patient healthcare information. Basically, with this one, they wanted to make sure it's secure and confidential so other people don't pry into it. Unfortunately, that's actually, most hospitals that I've looked at haven't really addressed that consistently.
Did you differentiate between those?
Working on that. Other things are consistency and compatibility across covered entities. Basically, if you're a hospital and you have clinics, you should be able to communicate with them. Yes, sir. 5? Okay. Be cost-effective, ambiguous, and predictable. Basically, they don't expect you to spend $30 billion to secure your network infrastructure, but HIPAA costs actually a lot the past few years. There are many hearings, but unfortunately, they act as even small mom-and-pop medical institutions and clinics.
$42 million for HIPAA requirement implementation in 2005. And I'm sorry, I don't have the slide, but I do have the site, and I can give it to y'all.
The rules also, the security rules, are supposed to be ambiguous and predictable. We have yet to figure out what that means yet. Security rules are items not covered usually in the privacy rule, such as the access of data, the encryption of data, and communication of data. The privacy rule does not actually cover these. So they basically implemented the security rule that was actually written a bit later on. So basically, they're trying to focus more on the access and auditing of the user's access to information. So basically, if I'm a healthcare provider, if I look at patient X, the audit log should actually show that I have looked at patient X. So if for some reason the patient X's employer wants to know who accessed the information, they could actually go back into the logs and find out who. Let's go down here to the bottom. Communication of data, data that is transmitted that contains healthcare provider information in regards to patient care. Everybody here had to fill prescription at another pharmacy, right? Yes? No? Like go to Walgreens to Costco? Well, basically, they have to transmit the information one way or another. Unfortunately, all the sender is required to do is call them up, try to confirm the fax number, and if for some reason they type it in wrong, the only thing that's covering the entity sending the information is actually this nice small sheet that says, this information is confidential. If this is the incorrect information, please notify us right away. That also applies to most clinics, doctors' offices, and hospitals. I mean, the only thing protecting them is this small piece of paper. It doesn't, you as the patient are not protected if they happen to fax it to, let's say, your office by accident or something like that. Also, other exploitationable parts of HIPAA, I see most doctors calling clinics and say, I want to have the results for for patient X. And the person on the phone would usually give it to them 99% of the time. No challenge response, no nothing.
I've seen that too.
Yeah.
Are you sure I'm supposed to tell you? I'm a doctor.
Yes, I have seen it happen. I mean, I got a few doctors mad at me for not telling them what the results are, and I said, I'm sorry, I will call you back. Click.
A lot of times I've seen them, they'll ask for authorization after they've given the information.
Right.
Or
Do
if
you
they-
work in healthcare?
No, I don't.
Okay.
No, I just-
So that's about my part of the
Hold on.
information.
I have a question.
Yes.
Good question.
So HIPAA's been around for like 10 years now. I assume
Actually,
they're
8,
making
but-
slow progress.
Pardon?
Do you think they're actually getting towards things actually being private, or is it still like
It's basically illusion. I mean, they think. Well, you notice if you go to the pharmacy and actually try to get a prescription, you see these nice small nifty terminals. Please sign here to make sure you're HIPAA compliant. I mean, I actually was standing in at this wholesale discount pharmacy, and the person said, "Can I have your name? Can you tell me what your prescription was for?" I said, "No." Or things such as.
I want to go today.
Well, I would
Thank
actually, I
you.
mean, the hospitals I worked at, I mean, I really know, I usually look at the caller ID log whenever they call in, and I could usually tell whose extension, if the doctor's calling from their extension or from outside the campus. If they're calling outside the campus, I would usually say, I'm not giving this person any information. I mean, it's not in the system. Or I would actually call back their office and give them the information to relay to the doctor. Or actually just, back in the day, we used to fax this information over. I mean, but it's subject to exploitation and also mistakes. I mean, people think sometimes an 8 could be a 3. I mean, a long time ago, I had patients get amylase tests because I was actually signing my initials saying I did it, and subsequently, 300 patients got amylase tests, which was $500 at the time. That was corrected quickly.
I wanted me to talk with you all because I don't think that you all know what the impact is of HIPAA regulations, not only on other people's healthcare information, but the implications on your own healthcare information. I don't know if you all understand this, that there is legislation before Congress that actually came out right before she and I decided to collude on this presentation for a national healthcare database. Do you
Yeah.
guys understand what that means?
I'll give you guys an example. Well, that's one thing, but another thing is, let's say the Department of Homeland Security actually has access to all VA records, and basically found records of people with PTSD, and basically put them on the do not fly list.
How many of you have served in government service, in the military?
We have to wrap up.
Only one? Damn! Yeah, I know. I'm a geek and I served, but that's okay. Go a little further with
So
this.
basically, if the government has your, if the government already have the information from the VA hospital, what would stop Department of Homeland Security knowing what type of medications you take, what type of doctors do you see? Do you have psychological disorders, or even are you prone to liver failure, kidney failure, pancreatic cancer, things like that?
Do you want people knowing this information?
And then a big national database.
Say that they don't have access to it right now.
Because most hospitals actually keep it on site. And most hospitals will not release information without a court order. Right now-
National database will release your personal healthcare information to anyone who is proscribed access to that information. Do you want that?
I have to admit, I'm kind of confused about what I should take away from your talk. You're saying that there are a lot of scary things in the pipeline, like a national health database, which I agree, that would suck. But you're also saying, look at all this regulation, it's costing us a lot of money. Certainly it is, and then you proceed to say, look, some of this regulation, the best example I've seen you guys present is HIPAA, just has certain things undefined or not clearly defined. Are you saying HIPAA should be revamped? Are you saying it should just be scrapped and a new thing should be created?
Well,
should
HIPAA
we
was-
scrap regulation altogether? I don't understand what you're telling me.
Well,
What we're trying to tell you is this. There is a way to walk away from this, and I was kind of like hoping that you guys would get it from the past 3 slides on my slide deck. There is a way to actually address the issues 80-20, identity management, storage management, okay? That's kind of what we were, and I guess we maybe screwed the pooch on that, but that's what we were hoping you to take away with this.
So again, I ask, do you mean scrapping regulation, updating the regulation to fix the shortfalls you're talking about, or doing away with it altogether?
There's no way to update the regulation to address it because guess what? Over the past 3 years, the regulations have been updated so often. However, I have been tracking the regulations over that time. So there are 3 areas of management that you, as an operations person, can address to keep from going postal on your internal regulatory people.
You're saying scrapping is the best solution?
No, don't even ask me that question. I don't want to go there. I think that, personally, I think that regulation in that arena is ill-thought and totally ill-advised. And I think it needs to be rethought. However, hello, FBI, I realize that there perhaps needs to be some regulation in how we deal with the management of user and personal identification. I just don't think that the feds have got it right yet.
So if you're saying that we've tried to update the compliance laws and we're failing that, you're saying I've got these simple steps, identity management, blah-de-da, whatever, to companies that can secure this, why would a company do that? If it's not being required by law.
It is being, dude.
Right. You're saying that the laws right now are too loose. That the
No, I'm saying the laws right now are too tight.
But you just proceeded to say how HIPAA had lots of holes in it. How can it be too tight if it has holes in it?
Wait a second. What's happening is this, okay? Try to wrap your brain around this.
I'm trying.
Try to wrap your brain around this. Meee spoke about HIPAA. I speak specifically to SOX and GLBA. I have been an operational entity in that kind of space. Do you have any idea, because I don't know what you do, and quite frankly, I don't care. Do you have any idea the difficulty of providing, how do I want to put this without being rude? Providing substantiated evidence that I have met Sarbanes-Oxley or GLBA requirements being on a quarterly basis now, okay? Providing that information while running my network on a daily basis, doing or creating new services on my network on a daily basis. It takes a lot of time. Something needs to be different in that space.
Right, so do we retool the regulations? Do we get rid of them?
Well, I'm asking you that question because you're part of the community.
But you're giving the talk on regulations.
But you are part of the community. We're giving the talk because we want to open the dialogue.
Regulations are here. They're here
Yes.
to stay. They're going to continue to add new regulations.
The new
We have
regulations
very
are
little
released.
power over changing the existing regulations, and any of the changes that are going to be made by Congress are going to probably just make them more confusing and more insane.
So how do we deal with this? Because quite frankly, I got to be honest with you, they keep changing them.
By saying your 80-20 rule, I think you're saying focus on certain specific controls that you can implement within your organization that are going to take care of the majority of the issues related to the regulation.
Yeah, and you know, maybe the talk that we presented didn't actually get to the crux, but really that was where I was going. There are 3 major areas that anyone for GLBA, SOX, HIPAA can focus on. That's going to focus on the 80% of the pain, so that anybody who is anybody who is working in the operational area is going to take care of 80% of your pain. That is going to be your identity management, your storage management. That's it. That's what they call out in all 3 of those rules. That's what they're concerned about. Who is identity management. Store your shit. I didn't say that word, sorry. Store your stuff. And you've got to follow the rules about your storage of your information. Yo.
One last question. If the HIPAA and laws like that, if they were actually implemented as they're intended, like if they did it right, do you know if this is all theoretical, would the U.S. privacy laws, do you think, be better or worse than what Europe has?
Oh, no.
I can't compare with the European privacy laws.
European privacy laws are draconian compared to the U.S. laws. Here's where it gets really icky. I will not call out any business's name.
We have to wrap up.
Oh, sorry. Very quickly. Any company that does business internationally has to address U.S. laws as well. And if you want to chat about that, we can have a chat about that.
Thank you, everyone, for coming.
And safe harbor. You got it.